This is Dr. Victor bringing you latest updates in cardiology this month. The first interesting study is total ischemic event reduction with Rivaroxaban after peripheral arterial revascularization in the VOYAGER Peripheral Arterial Disease trial. As we know, patients with peripheral artery disease undergoing lower extremity revascularization are at very high risk of major adverse limb and cardiovascular event. The VOYAGER PAD trial demonstrated that Rivaroxaban 2.5 mg twice daily reduced first events by 15%. The benefits of Rivaroxaban on total events in this population was still unknown. The objective of this study sought to evaluate the total burden of revascular events in patients with peripheral arterial disease after lower extremity revascularization and the efficacy of low-dose Rivaroxaban on total events. In this study, patients with peripheral arterial disease undergoing lower extremity revascularization were randomized to Rivaroxaban 2.5 mg twice daily plus aspirin or aspirin alone. The primary endpoint was time to first event of acute limb ischemia, major amputation of a vascular cause, myocardial infarction, ischemic stroke, or cardiovascular death. The current analysis considered all events, first and subsequent, for components of the primary endpoint as well as additional vascular events including peripheral revascularization and venous thromboembolism. As a result, Rivaroxaban significantly reduced total primary endpoint events and total vascular events by hazard ratio of 0.86 respectively. An estimated 4.4 primary and 12.5 vascular events per 100 participants were avoided with Rivaroxaban over 3 years. Conclusion from this study was that patients with peripheral artery disease undergoing lower extremity revascularization are at a very high risk of adverse limb and cardiovascular events with particularly high burden when considering total event in spite of standard available medical therapy. The risk profile in patients with symptomatic peripheral artery disease is dominantly driven by adverse limb outcomes, particularly after lower extremity revascularization, including acute limb ischemia, major vascular amputation, and recurrent revascularization. Rivaroxaban 2.5 mg twice daily with aspirin versus aspirin alone reduced first and subsequent adverse limb and cardiovascular events with an even greater total benefits when considering all events. Thank you.